We are rolling, mate.
Cool.
How are you?
Good. How are you?
Yeah, not too bad, thanks, mate.
Yeah, cool.
What is the motive for today then?
Plan for today, estrogen and TRT.
Okay.
So we'll start off with what is estrogen. It's typically thought of as the female hormone. It's not really doing it justice because it's really important for men's health as well. So it's really important for brain health, cognition, emotional stability, things like cardiovascular health and looking after your bones and joints as well. Also libido and sexual health, as well as like insulin sensitivity and metabolism as well. In men, estrogen is predominantly coming from the conversion of testosterone into estrogen through an enzyme called aromatase. Remember that because it's important for later on. Yeah, so why does estrogen matter in TRT? Like, why are we fussed about talking about it at all? Well, obviously with TRT, hopefully, and the plan is testosterone goes up, and with that is usually a rise in estrogen as well, which is normal, expected, and necessary for normal physiology. Now, at the men's clinic, we practice gold standard daily microdosing with testosterone cypionate and HCG. Part of the reason we do that is we don't have these big spikes, which can lead to things like estrogen shooting up. But also because we use HCG, that's stimulating the testicles to produce testosterone, where that aromatase enzyme we talked about before is a little bit more active. And you do get a nice, normal, natural conversion of testosterone into estrogen, so you've got that nice, balanced physiology. That's the plan, anyway. Symptoms of high estrogen. So some guys on TRT are more prone to high estrogen levels. The reason for that tends to be high body fat percentage, because aromatase is a bit more active in that area of the body. If you are not metabolically the healthiest, or the liver's not as healthy as it needs to be, again, it's all to do with that. Sometimes genetics plays a role as well. And then obviously it doesn't happen at the men's health clinic, but if you're doing bigger doses less frequently, again, you can have that big spike, which leads to a rise in estrogen as well. So what we're looking out for in terms of symptoms of high estrogen, so things like water retention, so that might be like puffy face, puffy ankles, that kind of thing. You can be a bit more anxious, a bit more irritable, libido might be a bit flattened, sometimes acne can be an issue as well. So all these sorts of things are things that can be an issue with high estrogen. The important thing is, if you're listening to this and have any of that, it doesn't mean necessarily estrogen's an issue, because these are very multifactorial and there can be lots of other things going on as well. So blood's always a key aspect of assessing that. Low estrogen is something to also consider, particularly on TRT. It tends to only really roll around if you're over-medicating in terms of suppressing estrogen, which we'll come to later on. The things we tend to look out for are things like joint pain, flat mood, again, low libido, poor sleep, fatigue. You'll notice there's some crossover with the symptoms of high and low estrogen. That's why you're guessing if you've got any of these and you're trying to assess things. And again, doesn't necessarily mean estrogen is the issue. If you've got any of these things going on, it's always got to be backed up by bloods and talking to your healthcare provider as well. So one of the questions you get asked a lot is, should I take an aromatase inhibitor? Number one is obviously only if your prescribing doctor has told you to. The men's health clinic, it's a last resort rather than a first line treatment if estrogen's high. The first thing we're always going to look at is lifestyle factors. Are there things you can do to modulate estrogen without medication? But if we do need to do that, we've got some tools at our disposal. Exemistane's our preferred option because it's this suicidal inhibitor, which sounds alarming, but it just means that we get this kind of fixed, predictable response from it because it binds permanently to that receptor. Now, if you Google it, you will see it's used for breast cancer treatment, which can be alarming, but the detail is important with all these things. So the doses they're using for breast cancer are, as an example, like 25 milligrams a day, because they want to completely suppress estrogen. We don't want to do that. We want to gently balance it. So, comparing to that, we use maybe 1 or 2 milligrams a couple times a week, so a fraction of the dose. And you can compare this to something like warfarin. So warfarin at high doses is used in rat poison, but obviously in much smaller doses is this life-saving blood thinning medication. So it's all important, the details. We do also have anastrozole as an option as well. It's less predictable because it's got this reversible aspect to its mechanism of action, but it does suit some people. It's really important that we don't overdo it with these medications, so always we'll start conservatively and titrate slowly, because all the symptoms of low estrogen we talked about, you can easily induce those if you overdo it with these medications. Beyond individual health, hormonal balance matters in society as a whole as well. So testosterone's got this close relationship with dopamine. So think of kind of like assertiveness, goal-directed behavior, that kind of thing. Estrogen's got this close relationship with serotonin, so kind of calmness, connection, empathy and emotional regulation. It's really important both in society and in an individual that we've got a balance between these two things. Too much testosterone can lead to kind of like volatility and you know, a lack of kind of empathy with other people. Equally, too much estrogen can lead to this kind of passivity and over calmness is probably the wrong word, but that kind of thing. At the Men's Health Clinic, everything we're doing is about balance and working with your body, not against it, and we're looking for this synergy in your hormones that can allow you to be the best, most kind of versatile version of yourself.
Final thoughts?
4 out of 10.